changing, we have to change ourselves. Like we have started now the simulation-based training that I feel personally that is like the fantastic simulation-based training whenever we are just realizing the real life or like the real situations, and virtual classes is also there. And I feel personally whenever I go to the, now also I go to the classes to like the, take the some of the feedback or otherwise for the taking the class. Nowadays the students are not like the happy to learn by the traditional method, lecture method. PPTs nowadays, the as the like the teacher started the PPT, students will be 123 slides. It will not be completed in the 40 minutes. So like the before the starting the class itself, the motivation of the students is not there. What if I will start it with the like panel discussion? If I will start with the some of the like group discussions, if I will just tell the evidence-based teaching, if I will go for the case study, I'm just telling all the methods. Nowadays we can just imply or we are implying it. So if we'll just like the exposing this all the things in front of the students, I think the new generation, those who are just in front of me, might be agree with me. They will be more interested in this all the like the evidence-based practice, like the studies, case studies, like the storytelling. Storytelling is a new concept. Like the once I have gone through, now if I will teaching, मेरे ज़माने में मैं ऐसा करता था, nobody is interested. But if you will be making the scenario, yes, the boy, yesterday I was going at house. That time in the, like the, at the roadside, one of the person was just there. So what is your opinion? How he will be just unconscious or like how he will be there? Some will be telling he might be drunk. Some will be telling he might be in the hypoglycemia. Some might be telling that he might be having the epilepsy. So these can be the reasons. So like the brainstorming is there. Some new ideas we will be getting and we will able to know that what exactly the persons can go through the situations. So like that most of the nowadays we are implying this all the things also, and I need like the, I just tell personally that we should go through the like the whatever the we will need based learning.
Need based learning.
Whatever the students are needing today, and according to the mood of the students we have to teach. Like if just one function is, now the conference is there. Tomorrow when the Godavari College of Nursing teachers will go to the class, will the student be in the mood on the, of the like the traditional class? Yes or no? No. They might be in the era of this conference only. So that time definitely we can just take the topic what you learn from this conference, which topics you like more. So like with the discussions we can go in deep and we can just learn.
Yeah, thank you so much. Sir, as you rightly said, ki we need to adopt innovative teaching strategies that will be based on the student's mood. Sir, if you want to create future nurses, competent and skillful nurses, at least we should try to inculcate as well as impose the teaching strategies. Those will enhance decision-making power of nursing students and clinical practice efficiency. So are there any practices or teaching methodologies are there they will increase the clinical competencies and the decision-making power after getting degree from BSc Nursing from any university? So I would like to ask to respected Dr. Vishwanath sir.
Hello. Good afternoon, everyone. As you asked about the competency in clinical area for the students, which other methods are there? There are a lot of methods are available which can be adopted by the teachers. First of all, in that from yesterday on, so I think there was discussion about the simulation-based education. That is the one of the best method nowadays it is going on. And by adopting that, we can prepare the students as competent as possible in the clinical area. Because it is a risk-free environmental study where we are not harming to the patients, so that we can learn many the simulation based. That is the one method. Secondly, as technology is advancing, then in that condition, recently I heard about the term that is gamification.
Gamification.
Yes. Gamification is the one more newer technology. It is booming now. It is presently used in abroad, and in future, I think within 1 or 2 years, it will be in India also. It is one of the best method to teach the students, where quizzes will be there, or games will be there that can be adopted. And already we know that artificial intelligence is taking place its own way, and that can be adopted in our teaching strategies, as well as VR, virtual reality and augmented reality. These are the two mechanisms where students can learn in a
Yeah.
like procedures which are taking place in the labs, that can be AR and VR technology, so that the procedures will be learned in 3D mechanisms.
Yeah.
That will be easy to understand what exact procedure we need to do and how it should be done. And such type of newer technologies are arising. I think that will take over of traditional methods in the future years.
Yeah, thank you so much, sir. Means you would like to say कि various advanced teaching models are available. Through that we can teach, we can implement. So my question to respected Dr. Milind Kale, sir. Sir, what do you think in future this technological tool will replace the teachers?
Definitely not.
Definitely not.
Definitely not. Because somewhere we have to teach even how to handle the technology.
Yeah.
There the teacher role comes. Yes, it's true that teaching is made very easy by the technology, but I'm very much sure that they will not replace the teacher, even in the future. Because you can build up with the technology on the basics. And for basic teaching, you need to have a teacher who is experienced, who can explain, who can demonstrate, and then only the students go for the artificial intelligence. That's what I can say.
Yeah, thank you, sir. Sir, but there is one concern while adopting new technology as well as digitalization as well as new tools. Do you feel that somewhere else we are missing old traditional teaching methodology as like lecture method? Previously we used to use as a overhead projector, a blackboard. Nowadays I used to see MSc students are not ready to use the blackboards. I used to see various teachers, they are just downloading the PPTs from SlideShare, and SlideShare is not given access to download the PPT. But there is one website, slidesharedownload.com. Oh, easily you can download somebody's PPT and you can present. People are just changing the PPT's front page. They will keep their name and they will start the presentation. So in these things, so that is the challenge some teachers are facing. So what you will suggest to current nursing educators to overcome these challenges? What are your suggestions for them to adopt new innovative teaching technologies in the nursing colleges?
I can answer this question with one sentence, that dear teachers, you can build up your own confidence.
Yeah.
If you are confident enough, you don't have to download from elsewhere. You don't have to steal the ideas of the others, but be a leader from the front. You can develop your own material and you can share that material with your students. Because getting downloaded PPTs or other material is not going to boost up your confidence. You will be always lose in the confidence when you are explaining those PPTs. Definitely, as you said, the teachers has to be teacher. I'll just take another minute from your, with your permission.
Yes, sir.
I always suggest even to the university that we need to have some TOT programs for the nursing professions. Because you see, because the INC has said if you want to become a teacher, you need to have 1 year experience. And then you can become a teacher with just a degree of a BSc nursing or a MSc nursing. But really, are you a teacher? That is the question. Because working as a professional nurse for 1 year, I do not know how much you are building yourself as a teacher with that experience. Because to be a teacher, you need to have a variety kind of a experience. As rightly Madam said, you need to be a leader of the team. You need to develop that team spirit among your team. You need to handle various kind of situations, problems. And at the same time, you have to work intellectually with your students. How I can simplify my subject so that each and every person of my class can understand what I am teaching. And that's what the difference between your technological teaching and the traditional teaching, what I can say.
Thank you so much, sir. Sir, there is also one more teaching I would like to come to respected Dr. Shivcharan, sir. I heard one word about social learning. As we are nursing professionals, in our syllabus there is one subject, community health nursing, and many times we used to send our students to outreach activity, social places, and our students are serving for the community. So how this social learning teaching activity will help our students to develop good and competitive nursing professionals for futures? Because as you work, I saw your CV, you work for social activities. You are a very good contribution for our nation. I really have proud on you. Sir has given his huge contribution for country through the social activity. But there is one teaching methodology, social learning. Okay, so how we can implement that social learning in the nursing colleges?
Okay. If we'll just, I'll take my experiences
Yes,
and
sir,
like
please.
till now. Like the social learning in my life, it contributed a lot. Starting from like the NSS when I joined in like the 2002, I joined the NSS. And one of the selection was there for the 26th January parade at the Delhi. And I was not selected because of the height. Always the matter was there that height should be there. But I was the first person, because if your height is 6 feet, you are not allowed to join there. Because all are there 5.8 or 5.9. So like that, NSS contributed a very major role in my life. I learned a lot. The leadership only I learned from the NSS only. So like in community also, the community and the NSS activities are similar, as you told about the community. So it is like a similar role is there. I just fused both of the community and the NSS programs and activities. And I would like to tell you, I learned the Marathi from the social learning only. I have to go to the village. I have to speak in the Marathi. And I have to just, because if I will not communicate in the Marathi, I will not come to know what is the need of the villagers. What should I work there? How we have to work there? If we want to work with them, so like you are just telling, it is having the major impact socially. And not only that, from the NSS, I just represented the Maharashtra and Goa 3 to 4 times at the national and international levels. So interaction with the foreigners along with all the officials, those who are in the country, I just learn how we can just grow, how we can just be a leader. How just most of the nursing subjects, if I will tell, it is not good for in front of the students to tell. I never read the books. Okay, I always listen the books. Those who are good, those who can interpret the books very well, I always found to learn from them, because whatever the written, like the things is there in the book, if I will read, I can interpret according to me. So social learning, I can just like from the sir also. Sir was just having that in 1982, he has just completed GN. I just telling to sir that time my birth was there. And so many things in the social networking now also whatever we are learning, that is through the social learning only. We are just coming into the conferences, it is social only. So definitely I support that social, like the platform is very good platform to learn, where we don't need any of the other tools. Like no need of the AI much. No need of the like the other facilities. That is like we have to go in the community and we have to learn there by doing. And once we will be do, definitely we will learn.
Yeah, thank you so much, sir. Sir, we were discussing yesterday in one of the sessions. Nowadays, we are lacking somewhere in the clinical side teaching that we used to call as a bedside teaching. Nowadays, due to the lack of teaching faculty members, that is manpower, and somewhere lack of time also, and extra burden on the teaching faculty members. So, do you think it is going to hamper future of nursing profession?
Yes, definitely. Actually, if we will see the scenario of today's, if we are having the 100-bedded hospital, we can open up the nursing colleges. One 100-bedded hospital is having multiple colleges like from the same, like the BSc, GNM and all. So the clinical facilities are not that much available nowadays. But again, if I will just come to the one point, AI is taking place to minimize this gap.
Yeah.
Like sir has told, the simulation-based training, virtual reality trainings that are taking place of that all the training and experiences. Why that we can just minimize the gap, but we cannot totally, we cannot tell that all the gap will be filled. We can minimize, we can learn the more and more things by this all the AI tools, by all this the available facilities. But the feeling which we have to go to the clinical area, we have to learn there, will not be comply anytime.
Yeah, definitely, sir. AI is not going to replace the teacher's role. So I would like to ask to respected Dr. Biradar, sir. Sir, what you can suggest for effective bedside teaching practices to our current teachers? How they can effectively implement bedside clinic practice, bedside teaching practice for fresher nursing students? And nowadays, when we are dealing with first semester and second semesters, they are new in the clinical practice. First time they are going to see the patients. And many times teachers are just showing them the hospitals, but we somewhere nowadays, we are somewhere we are lacking to spend time with students in the clinicals, teach the bedside clinic. So I would like to hear from you, what are the strategies as well as things you will suggest for current teachers, nowadays teachers, to effective bedside teaching?
Okay. First of all, there is one challenge, I can say that is the resistance to change. As a teacher, we are not ready to change ourselves. We want to be in a routine way. We don't want to teach much in the clinical side. That mentality, first of all, we need to change. That's why what to do, first of all, there is a lack of confidence among teachers who are not going at the bedside. If we go through the comparison of both the categories, who are having clinical experience, who are not having clinical experience, in that condition, what happens, who are having this experience, they will be more prone to go as per the one way. But it may not be in all the conditions. But the simultaneously who are not having much clinical experience, they are hesitant to teach in the clinical area because they are having the fear that whether I know or not, whether students will ask the questions, how to answer that. That fear is there, because of that they are not doing. For that also there is a solution. They can learn, they can update their knowledge, and so that they can adapt to the newer situation. That is the one thing. That is updation of knowledge, and second one is up to date of innovation technologies, innovation teaching methods in the clinical area. Like they can go through the case discussion methods, problem solving methods, or this simulation based learning can be applied in the clinical areas, so that they can teach students in clinicals in an effective way. But most of the time, with our all experience, I can say that it is a lack of interest among the teachers, which is leading ineffective clinical teachings. So that we can overcome that problem with many solutions also.
Yeah, correct, sir. Because we need to, yeah, sir. You want to add
Just,
some points?
I'll add few points with Biradar sir. As you said, the clinical teaching is best or no, right? See, previously, the clinical setup were different comparing to the present situations. Previously, we used to get all sort of clinical experiences under one roof. But the today's scenario is changed up very fast. For each and everything, there is a specialization. If you want to go for the cardiac cases, there is a cardiac clinic. If you want to go for the nephrology, there is a separate hospital. Likewise, every specialty has become separate. And it is very difficult to provide the holistic overall experience to the students under one roof. Now the teacher who is experienced in the obstetric gynecology, and if you will post that teacher into the cardiac unit for the clinical teaching, definitely the teacher is going to find the difficulties. This is one. The second thing, the present teaching methodologies what we have adopted in our profession, like OSCE, simulation labs and sort of things, they skill the persons, but they are not giving us guidance how to utilize that skills and the knowledge on actual patient. Because don't forget, every patient is an individual patient. And every individual has got a different needs. You cannot compare my OSCE stations with the real patients. And that's why we are finding this all difficult. The teachers are experts to handle the OSCE stations, but the same teacher is falling short to handle the real situation in the hospital.
Thank you so much. Sir, there is another one effective method I heard, that is a peer teaching, peer group discussion.
Yeah.
So, I would like to hear from you how it will be effective for our students to improve their confidence as well as clinical practice also.
Yeah, you might
And,
be...
and in which subject we can implement this peer group discussion?
You might be saying that this is new technique, but I will deny that.
No, this is old.
Because peer teaching used to happen in the clinical area, and I am the most example of that. Because whenever we used to go for the clinical postings, our senior students, they used to take our classes, they used to provide us proper clinical teaching. Because everywhere you cannot find the teachers. But when our students are posted in the clinical areas along with the senior batches, the senior students, they teach more effectively to the junior students. And I think the peer teaching has a value, it has the importance, and it has the good opportunity in our profession. Because see, night and evening we are posting our students, especially senior students are posted in the night and evening shift. And at that time we are lacking the teaching faculty or senior supervisors in the clinical areas. There this senior students comes in the picture. How to handle the delivery, how to handle the newborn babies, how to give particular kind of procedures. Okay? So these all things can be taught by the peer team. See, again, the education is, again, two different areas. One is classroom teaching, other one is a clinical teaching. But in the clinical teaching, I definitely say the peer teaching is more effective.
Yeah. Yes, sir, please. Thank you, sir.
I totally agree with Kade sir. In our time also, 15, 17 years back, we learned by our seniors only. Peer group discussion was mostly effective during that time. Nowadays, I think we are missing that peer group discussion. Now, again, as we discuss, old is gold. That is coming back. Now, peer group discussion will be effective in further years. To learn to learn the clinical procedures or clinical cases, peer group discussion is the best.
Thank you, sir.
Actually, sir, in this I want to add the new era or new scenarios, whatever is going on. I'm agree with your point definitely because I also learned from the same like the era where the senior has to taught to the juniors. But nowadays I want to ask any of the like the participants here there, they are not adapting that situations in nowadays. Like the juniority, seniority is totally gone nowadays. If you will see, this repo of the junior senior previously it was very like the it was effective and we have to learn from them so much. Now the thing is that when they are just posted in the clinical area, the juniors are hesitate to ask to the seniors. Seniors are hesitate to just tell to them. They cannot tell the work also. Please, will you just give this injection? I am there with you. So like the hesitation is there, the good repo is not there in between that. Somewhere it is missing. I am not telling that 100%, but somewhere I have just gone through this so many hospitals and all. Just I am taking the experience like the I have to go and observe, but it is not that much competent. So we have to work on this. Whatever we are telling our experience, but somewhere we have to go to the clinical area. As I go always to the clinical area, and I just make the senior students to be with me, and they have to deliver the things. And I
Correct,
will
sir.
just observe and be with them. So we have to work on this, that we have to always be with the senior students to teach the, like again peer, I will not tell the junior and senior, all the peer groups.
Yes, sir, please.
Absolutely right, right, sir. Even I came across with this, what I can say, egocentric phenomenon. But I tried to come over this phenomena by appointing senior students as a mentor to the junior students, so that that difference will be neutralized.
In that only I want to add, whenever we are just approaching anybody, it should be felicitation. We should be felicitator or mentor. We should not be a teacher. The senior also should not be teach them. They should be felicitate the senior. They should be a felicitator there. They should be mentor there. So once this gap will be like the filled, definitely we will be learning and we will be just going for the good era of the nursing.
Thank you, sir. As you said, seniors are mentor to them. Nowadays, we are adopting in universities as per the new NAP policy as well as NAC guidelines. There is a mentorship program for each students from the teacher side. How it will be helpful for the? How it is really helpful to the students? Are the current nowadays teachers are really mentoring to our nursing students? And that is one thing. Though we have appointed mentors, but are the students are approaching to the teachers? And what is the benefits from this, through this mentorship?
Okay. As it is mandatory in the NAC
Yeah.
mentor-mentee system, it is effective one way, but as you mentioned, are they willingly coming and approaching the mentors? No. As we schedule, it is one of the difficulty at the beginning that students are not directly approaching the mentors and other things. By forcibly or we schedule that this Saturday you must reach to your mentor and you have to discuss about your problems, then only they take initiation in that particular process. Then second one, here what happens, I am not sure that students will express all the problems with the mentor. Again, it depends on the mentor's quality of counseling. Based on that, they will share their experiences. If they share their actual problems, then automatically it will be effective.
Yeah.
I agree for that. It will be effective if we implement it in a right way.
Sir, one thing is similar to mentorship, that is a feedback. Feedback. So I would like to hear from the respected Dr. Milind sir. Sir, many times teachers forget to ask feedback about their own teaching methods. No teacher is asking whether you liked my lecture, whether you are satisfied from my teaching or not. Nobody is asking to the students. So what do you think? It should be implemented feedback system?
Definitely. I will connect with Hussein sir's session
Yeah.
regarding the quality.
Huh.
While speaking, even Hussein sir has underlined this, the feedback. See, this feedback is essential to improve a personal quality, me as a teacher, as well as the need of the profession, both the things. The feedback, personally, when I am asking my students, please tell me the areas to be improved. Did you understand? Did you follow? Can you answer these particular questions? Sort of a questions I am asking, and I am trying to collect my own feedback, because no student directly will tell, sorry sir, what you are teaching we are not understanding. Am I right? So there are different ways to collect these feedbacks. How do you collect your feedback about yourself and about the curriculum that is also there? And if you want to bring the quality in our profession, quality in a teaching, definitely the feedback plays an important role, because that gives you a clear-cut idea, the areas where you need to improve, the areas where you have to give a more weightage when you are teaching, sort of a things. So feedback definitely we need to collect. And these feedback can be collected after each class, after each unit, or annually. When I am collecting, whenever I am teaching to my PG students, I always ask, do you understand? Can you answer this question? You. So this helps me for myself to evaluate my teaching. Now again, every person is a different from each other. So individual differences will be there. So every teacher, if they will bring out their own strategy to collect the feedback, that will help them to improve themselves, as well as that will help them to what they are teaching. So definitely feedback is the essential thing.
Thank you, sir. So, sir is saying ki after having any lecture, after taking any lecture, every teacher must collect the feedback from your students. So that will be a one kind of self-assessment for teachers, and that will really helpful for the teachers also to improve, and students will be happy from this. So we can suggest to our teachers that they should do it for every lectures, otherwise weekly, otherwise after each unit also.
Periodically?
Periodically also we can. Sir, there was
Actually,
also.
sir, I want to add in this because
Yes, sir.
because again I have taken experience of the feedback.
Huh.
Sometimes it happens if the students are agree with me, whenever they are giving the feedback, it should be in the positive way, right way. Sometimes it happens they are giving after the class or after the test or anything, they are giving the feedback. The teacher will be starting like the another behavior, anything. So feedback, according to me, feedback should be always when the students is passed out. They passed out the first semester, the feedback from them should be there, because a particular students are having in the mind, yes, this particular 3 teachers are there in the first semester. If I'll giving any of the feedback, and that feedback is also always we have to act, tell them point to be improved. If we are telling that also, sometimes it happens that is not working once we are just completing all the sessions. So I think the feedback should be taken from the peer, not from the students for that particular teaching we are doing. Whenever incidentally, whenever you are just teaching now, we can take the feedback from the peer that time, but we can take the feedback of the students after the completion only. That is my personal experience I've gone through, and we have improved so much in that. Okay. So that is my opinion. Definitely it can be the opinion of the others.
Would you like to add something, sir?
I prefer for periodical feedback methods, so that teachers can improve their teaching strategies or teaching methodologies. Sometimes what happens, as a teacher, they may not be understanding where they are lacking, or they are unable to identify the level of students, whether they can understand their teaching methodologies or not. In that condition, instead of end of the year, I prefer that periodically there must be feedbacks. But again, as sir mentioned, from the student's point of view, it must be in a righteous way and positive way. It should not be like a hated feedback.
Yeah.
No. Nowadays, that is most common. If that particular teacher is so much strict and other things, then automatically it is, even though that particular teacher is teaching in an effective way, that is opposite way, it is reflected in feedback. That should not happen.
Sometimes it may happen. And teachers should take it positive way.
Like the rectification should be there after the feedback.
Yeah.
Once feedback is taken from the students, rectification of that particular feedback should be there. Like I also do sometimes. If the students are giving the feedback of any teachers, and that is according to mood of the students, according to incidence of the teacher and student, then we have to rectify. As we all are having the like CCTVs in the classrooms, we have to just see what particularly was happened and how we can improve. So we also can give the feedback of the teachers as a peer. Along with the students also, if we want to take the feedback of the students, definitely name and others we are not taking, but it should be whenever they are in the good mood. अभी टीचर चिल्ला के आया और हमने फीडबैक लिया, डेफिनेटली इट विल बी बैड.
Yeah.
एग्जाम लिया, एग्जाम में एक भी क्वेश्चन बाहर का आ गया, डेफिनेटली दैट फीडबैक विल बी डिफरेंट.
Yes.
So that's why.
Thank you, sir. I request to all the teachers, please take your own feedback from your teachers as our panelists suggested. Another one thing I would like to ask you, sir, Dr. Shivcharan, sir.
Yes.
We have UG and PG programs, right? But many times it happens, teachers are adapting same teaching methodologies for UG also and PG also. So, what do you think there should be a different innovative teaching strategies for PG students? So I would like to hear from you what kind of different teaching methodologies we can use to teach PG curriculum in PG program.
Sir, definitely there should be the difference in the teaching like the methodologies, along with that the scenarios, along with that the environment.
Yeah.
Like if we are just teaching the like the graduate students, the group is also, the large group is there, PG, the group is less. We have to go for the environmental teaching. Service learning. Service learning is one of the concept that we can imply, that we can just always use in the PG teaching. Service learning is what? Whatever we are just learning in the classroom, we are learning through the syllabus, we have to post that students in that area. For example, always like in the community health nursing, there one the industries or industrialization is there. So just we are just teaching in the classroom, we will not come to know. If we will doing the service learning, we will be posting that students to that particular area. Like from the Bharati, they are just going to the Mumbai for the industrial training. So like that, we have to just put them to the industrial areas, there they can learn more. So that is the environmental learning, in which environment we have to put them. Second time, nowadays, I think you will be agree, most of the teachers are doing it is self-learning. There's no need to teach to you. You also might have gone through this all the things.
For PG students.
Sometimes, yes, for the PG students. That you are already UG. And one thing I want to just like the request all the teachers, they are PG students, they are not PG. Whenever they are submitting assignments, we are telling them, this is PG level, you are giving this assignment to me, but no, they are not PG, they are not pass out PG, they are doing that. So some of the things we have to understand according to the students' level. We should not forget that they are just graduate. But we expect sometimes that they are like already done the PG. So we give the situation with, today I am not going to teach you, you are just going to teach us. But that scenario should be different. I should felicitate you that yes, today we are just going to learn this. What is your ideas? What you have learned from the different institute? What is your personal experience, like the clinical experience or like any of the theoretical experience? So like that more and more discussion based we can do, scenario based we can do, and just I was telling that service learning should be there, and the second one was the reflective learning. Reflective learning, yes, that is also there. Reflective learning is there whenever the student is realizing themselves that how deep I should go. One thing is there, once we are just teaching in the class, definitely we just keep in our mind that all the levels should be same. But sometimes it happens, one student is always depressing their self. They are not motivating their self. So that time reflective learning also should be utilized, that we have to just sometimes watch each and every students personally. We have to just talk to them. We have to know the level of them. Yes, today what you have learned particularly. In because again it is a like the small group, maximum 30 students. Again specialty wise only the 5 or 6 students. So I want like it is my suggestion that we have to go like the service learning, like the reflective learning, along with situation based, all the evidence based learning we can go for them.
Thank you, sir. Sir, there is in nursing education in MSc, and I saw there are some activities for the PG students as like a field trip as well as visits to the some places. But in our nursing, for first year BSc nursing student, we used to take them to the dairy plant, sewage plant. I would like to know ki what we can improve, in which area we can improve the field trip so our students will get the benefits. Nowadays, see educational visits, previous institutions used to do the educational visits. Nowadays, if you'll see in the crowd, teachers are attending conference, PG students from other colleges, they will not attend the conference because that initiation is not coming from the teachers. Nobody is making them compulsory. INC has given guidelines to complete the nursing education in first year MSc. At least you should attend the conference, you should organize the conference as a PG students. So what you can suggest for our teachers, how they can implement? I would like to hear from Dr. Milind Kale sir, how nursing colleges can implement these things, how they can motivate their students. Because see, for the motivation, there will be a problem for finance, time. Nowadays, students are not ready to participate. If we will tell them, please go and participate in that conference, go with paper, go with poster, students are not ready. So, as a leader, being an administrator in the nursing college, how we can motivate to our students as well as teachers for this type of field visits, attending some FDPs, conferences and the workshops?
Yeah. See, the current era has brought these essential requirements in our curriculum that the student has to go for the field visits. And why they should go for the field visits? Just now you spoke regarding in the first year BSc nursing, we are taking our students to the dairy milk or sewage treatment plant. Years together, we are arranging these field trips without any thinking why I am doing these field trips. My question to all the teachers, what are you achieving by giving a visit to the dairy milk, except lassi and milk?
They will have lassi over there.
Just there is one small topic somewhere in the microbiology, if I remember, called pasteurization. And apart from that, there is no any linkage found in the curriculum about the dairy milk. But still, years together, I remember in 1979, when I was in the first year of a GNM, we were taken to the Miraj sewage plant, Miraj milk dairy for the field visit. And today also I am sending my students for same field visits. No innovation, no intellectual thinking. See, this is what I am trying to tell, the need of the TOT. I must read my syllabus and plan where should I take my students for the field visit. I am teaching nursing foundation for first years, and the nursing foundation I am taking these many hours for the assessment and teaching nursing process, how to plan the patient's unit and this thing. But I never think I can take my students for the field visit where they can see the whole demonstration. This is what we need to rethink, reconsider, replan, and implement in our curriculum. Yes, those days it was this thing, how to maintain the sanitation and this. But that has gone back now. Come to the recent era. Now you can take your students for the field visit to the well-developed simulation laboratory. What is this virtual demonstrations? How I can take my students there, how they can learn this. Because it is not a capacity of each and every nursing institute to have these kind of laboratories. But we, young generation people, you can think about this, arranging these kind of field trips where the students are going to get the benefits. If you plan these kind of things, definitely your students will feel motivated to go for the conferences, to attend the seminars. Because we are planning most of the conferences and most of the seminars by fixing target group. Sorry, with due respect to the Maharashtra Nursing Council, Maharashtra Nursing Council is asking, okay, for whom you are conducting the conference? Is it A&M, GNM, teaching faculty, or nurses? When we are planning these kind of conferences, we as an organizer, we are lacking in our confidence. Are we going to get of the delegates? No. Then I am trying at the end, please send your students for this conference. Please send your students for this conference. And at that time, the students are looking at the brochure and they say, oh, this is useless. What am I going to do by attending this conference? There is no proper motive for the students to attend those conferences. Because the conference is of the syllabus. Come to the syllabus and see what response you will get from the students. Sorry, but this is my personal opinion.
Yeah, thank you, sir. So these conferences, workshop, FDP, that can be a innovative teaching methods. Those can be helpful for the students in the learning, as you said. Sir, there is one concept, there is collaborative learning. One participant has asked one question also on collaborative learning. How it will be helpful for the students to gain the nursing knowledge as well as experience, collaborative learning? Because nowadays many universities, they are doing this collaborative learning, as well as ma'am also told in the her session, interdisciplinary practices. So how this collaborative learning practice will helpful to the nursing students?
Yeah. Again, connecting with ma'am's session this morning, collaborative learning has got the importance because we as an healthcare workers, we need to establish a proper teamwork. What the doctor is talking, see, nowadays the old trend has gone, open surgeries. Robotic surgeries are implemented in the medical profession. And when I'm trying to assist a robotic surgery, which college has taught me how to assist a robotic surgery? Here, the collaborative learning comes in the picture. We need to recognize the need of the current era, current technology, and how to cope up with this current technology. Because just merely understanding what is a surgical asepsis, medical asepsis, I cannot assist with the robotic surgery. I cannot go to the cath lab and work along with the cardiologist to perform the cath lab investigations. For that, definitely, we need to have a collaborative learning so that we can teach to our students apart from syllabus, but which is very essential for their clinical practices.
Thank you, sir. Sir, in which subject we can practice collaborative learning? For example, microbiology, it is possible, I think. Even for nutrition also it is possible.
I think in almost all the subjects we can go through the collaborative learning, or in other words we can call it as an interprofessional collaboration.
Interdisciplinary practice.
Interdisciplinary or as well as interprofessional also. Similar it is. We are working as a team for the betterment of the patient care. In that cases, we have to depend on each other. We have to depend on physician, physiotherapist, dietist, pharmacist, and so on. Hence, there is a requirement of this teaching among the nurses.
Yeah. Sir, you want to add
yes,
something?
yes.
Yeah.
In the collaborative, like the learning, it can be like the two dimensions of the collaborative learning. What is within the campus or like the within the our we can tell the like in the nursing field. Along with that, we can just do the collaborative learning with the along with the in the other countries also. Like we are having the like the exchange programs. Like the Bharti itself, when I was there, we have to get the students from the Sweden for the 3 months. They have to come to the college. They have to learn the activities whatever we are doing, and our students are going there. So for that, I didn't went any time to the Sweden, or I didn't interacted much, but I've taken interest to learn what exactly this scenario is going on. It is just only to go and come, or it is like for the learning purpose. So nowadays, whenever we are just started like the this semester pattern now, they were having this semester and the credit-based system previously only 10 years before, and now we are just like the started with the this. Sometimes we are having very difficulty whenever we are just like the running this all the semester patterns, but I am having the clear-cut ideas regarding the this all the semester and the like the this credit-based systems. There the teaching methods is like totally different than us. They were just like the for the teaching also. The student has to choose themselves whatever the elective and the selective and this all the modules is there. Here we are just training them. Have we have asked any time to the students which elective modules you want? Never. Whatever the teacher is available, they will tell this. We are just like a conference, like any of the, we have to complete the module. That is the thing. So we have just interacted with the all the students. Difference is there definitely. Within like the few years, we will be grasping that like the all the practices, and we will be doing best. Definitely, it is there. But I am telling there's some difference. So collaborative like the learning is always beneficial. In like the if you will see the like the disciplinaries like the anatomy and physiology, when we have to learn, we have to go to the medical college, we have to touch the body, we have to dissect the body, we have to see the, all the organs. Today also, if I will just teaching the liver, I will feel that day that liver was there in my hand. It was near to 1.5 kg. I just dissect. Oh, इसका color तो बहुत अलग था. इसमें image में तो बहुत अलग है. So like that, all the feelings we are having. So definitely, collaborative learning should be there, and we have to collaborate wherever the best practices is there. Like the SGT is just they are just providing this simulation-based training. Definitely, we can send our students there for the 7 days. Just you also have taken here.
Yes.
Just I just in the social media it is good. I was able to see. So you have just exposed all the ACLS, BLS, and all the things here. So like that, we can go for the collaborative learning. It will be beneficiary.
Yeah, sir, as you said, the simulation things, I would like to ask Dr. Vishwanath sir, this is a new concept in the education teaching methodology, simulation. So what are your suggestions to our nursing educators, how they can implement simulation practice? Because many teachers are thinking कि we don't have mannequins in our college, that's why we are not able to do the simulation. We don't have labs because teachers are not aware about the things. So what is your suggestions to the teachers to adopt simulation teaching methodology in nursing education?
First of all, we need to, as a teacher, we need to understand that what exactly simulation-based learning, because it is a bit different than the other teaching methodologies. Even though having the mannequins, even though they are not having high fidelity mannequins, they can go through the simulation-based education. That's why, in simple way, it is not that much upgrading word that simulation-based learning, it requires only high fidelity mannequins and other things. Even we can conduct the simulation-based learning in other situation also. There are, you can create the scenarios and we can have the as madam mentioned, and yesterday also you learned about that thing, pre-briefing, debriefing, that can be done. There is not much fear about the particular word that, and if we are not having that simulation labs, then automatically nearest or when you are having medical college, automatically there is a medical education technology cell. They will be having the mannequins. Over there also we can learn.
Yes, sir. With the collaboration with the some institutions, we can practice through the simulation and we can teach the clinical things to our nursing students. Thank you, sir. Sir, I would like to ask to Dr. Milind Kale, sir. This is questions regarding future point of view. As INC started FDP program on simulation to the teachers, do you think there is a need to start any faculty development program for the nursing teaching professionals as like a simulation? So in that faculty development program, we can teach to our nursing teachers about various innovative teaching strategies.
Definitely, even if more than that, I can say it should be made compulsory.
Yeah.
Because as I said during previous discussion, that to become a nursing teacher, you don't have to do anything. Only you have to obtain a degree of the BSc nursing or a MSc nursing, accumulate 1 year experience and become a nursing teacher. But that is not bringing that quality in the teaching of those teachers. The teaching needs a personalized extra efforts by which you are producing next generation. Don't forget, you when stand as a teacher on a podium, you are trying to form a next generation of the profession. So that quality, if you need to bring in the teacher, definitely these kind of programs has to be performed on a regular basis and which should be made compulsory. And that's what the Maharashtra Nursing Council has been started to provide a credit points through which every nurse can upgrade themselves. So that upgradation is a need of today's era. If you won't upgrade yourself in your profession, you are going to lag behind. So every individual teacher has to focus for the faculty development programs. Wherever, whenever it is possible, please go and attend these programs and learn many more things by which you can develop yourself. Because today, the nursing is not limited only to the bedside nursing and the teaching, but everyone must be aware that we are thinking about the space nursing. And that can be achieved only by developing yourself as a nursing faculty. You have to bring these qualities in yourself as a teacher, that how I can motivate my students to learn these things. Madam also spoke in the morning that there are variety of specialization program in the nursing at present. Even we might be not knowing, yes, really this is there. But I believe, have anybody heard about the forensic nursing practices? Where it is? In which city forensic nursing lab is available? At present, forensic nursing lab is existing in Pune itself. Am I right, sir?
Yes, sir. There is one institute at Gujarat, Ahmedabad. They have developed their own forensic university. They started their PG program in forensic nursing. They have their own forensic nursing laboratory also.
Yeah,
as like
that's
Pune.
Means these are the new things coming, and we are falling short to accept these challenges because we have not developed ourselves.
Yeah.
So if you want to develop yourself, definitely a faculty development programs are essential, because everything cannot be taught within the four walls. That's why the new technique came, flipped classroom.
Yes, sir.
Okay. So the flipped classrooms and these kind of technologies are going to help you out to motivate this young generation to adopt this. And don't just make yourself satisfied by earning a BSc nursing degree or MSc nursing degree. This is just basic, grassroots level degree in the nursing profession in today's era. You think beyond that, then only you will take the profession to the space.
Thank you, sir. Sir, yes, please, sir.
As now discussion is going on FDPs,
Yes, sir.
there must be initiation from the our affiliated universities.
Affiliated universities.
Frequently, they need to conduct the, as sir mentioned about the TOTs and other FDPs or continuous professional development programs. That must be initiated by the universities or the State Nursing Council and Indian Nursing Council, so that it will be helpful for the teachers. And as sir mentioned, be compulsory. Okay. Nowadays, in MUHS also there are two programs. One is basic educational technology, a resident as a teacher. That is a 3 days workshop. If I think many of the teachers has undergone that method. It is a really wonderful FDP, so that each individual will come to know as a teacher what is my role and what I have to do. Okay. In that also there is a one more advanced level. It is a 6 days workshop. Okay. Most of us are unaware about such FDP programs, and it must be made as a compulsory, then only we can achieve betterment in the quality education. Teachers also will get the betterment in their teaching strategies or teaching methods. Okay. When I have undergone my own personal experience, I can say that it was a wonderful workshop where I learned many things, how I should behave with my students, how I can encourage my students to learn, how I can motivate my students to learn. Such things will come to know. And there is one more FDP which is conducted by the MUHS, that is related to research. Basic research methodology workshop and advanced research methodology workshop. But I think it is limited as it is made compulsory for PG students to submit the synopsis, or to become the PG guide. It is mandatory. That's why only that particular population is exposing to that. Instead of that, it should be mandatory for every teacher.
Every teachers at
Then
every
automatically
colleges.
it will be having more impact on the teachers.
Yes, thank you.
Yes,
Yes, sir,
just
please.
I want to add one of the things, like definitely I am agree with you that it should be mandatory, it should be compulsory, all the things, but it should be started from I. मुझे ये करना है, मुझे develop होना
Yes.
है. Till the time this feeling will not be there, the compulsion and all will be just physically attend some of the FDPs. Like if I will just take the example of me, I have never stopped learning. MBA I've completed MSc in clinical research, I've just done the PhD, TOT of the minimum 11 to 12 TOTs I have done, and now next I've taken admission for the law, LLB. So like it should be from the I, because definitely your degree will never go. It will give you, it will pay you in the in the respect, in like the position, in the society where you want to exist. It is not necessary you have to show yourself. So just this is my request. Once we want to develop ourselves, we want to think of ourselves, it should be from the I. Yes, I will do this. Definitely all this compulsion on that term will not be coming. It is just we are thinking that our colleagues, our followers should grow. That's why we are just telling this terminology here. But definitely if once we will decide, yes, we have to learn, we have to grow, we have to exist in the society. If I am just standing in front of now those who are coming in the first semester, their computer is very the computer skills is very high. If I just take any of the teachers, those who are not having the experience, for the green belt in the Six Sigma, I should go for the advanced Excel. I should go for the computer applications courses.
Yes.
So that is the self development is again very necessity, and we should be thinking of that.
Thank you, sir. As you said, many courses are required through this FDP, through conferences we can achieve, and learning should come from within. आपके मन से आना चाहिए. Very nicely, sir. Sir, we are coming to end of our time, but last question that is related to the future of nursing, because nowadays you can see young minds are taking admission in the nursing processes. What do you think in future nursing teachers, if they will not adopt the new teaching strategies or innovative teaching methodology, so they will face the problems. Definitely they are going to face. So what is your request to our teachers? That is the last quote I would like to hear from your side. Ki, what is your suggestions to our nursing educators? What are the implementation to the administrators and the HOIs of the colleges? Ki they should adopt these things. So nursing education and teaching learning standards will be developed, and in future we will create the competitive and skillful nurses for the nation as well as for international society.
Yeah, for this, what I can advise, that feel responsible for the next generation. What are you going to, आपण मराठीत एक म्हण म्हणतो, जे पेरू
ते उगवतं
तेच उगवतं किंवा तेच कापू. तर लक्षात ठेवा की you be as a teacher, what are you going to teach to your students, that only is going to come up. And that's why before standing in front of the students, ask yourself one single question: am I capable to face these students, to stand in front of these students? Do I have prepared myself to answer their query? And then only you go enter into the classroom. You are a confident, you will not hesitate in front of students. So you need to upgrade yourself as a teacher. You need to understand the need of a today, and the need will be for tomorrow. Because I am the person in Telegram, then that phone, then that mobile handset came, and now the smartphone came. So with this, I have, sorry to say, but really understood what is the need of tomorrow. If I want to stand tomorrow, I have to learn these things. So likely what sir says, that he never stopped learning. So my dear ones, please, you also take this note to your home, that you will never stop learning. You have to keep on learning about the new technologies, about the new knowledge, and don't forget, the science is very fast. Science is bringing all kind of innovations in health system. And we all proudly say that we nurses are the backbone of the health system. And if you want to be a real backbone of the health care system, you need to upgrade yourself on daily basis. When you do this, definitely you are going to bring up our profession, and you will see that our profession will always stand as a backbone in the healthcare delivery system.
Thank you so much, sir, for this motivational as well as supportive and fruitful words for our profession. As we are coming to end of the timing, as we have covered, we have discussed about the challenges in front of adopting as well as implementing innovative teaching strategies in the nursing profession. I can understand कि due to the lack of time, extra burden on the teaching faculty members, many times, though we are interested to implement some innovative teaching strategies, we are not able to do this. But if you want to become a good teacher, ideal teacher, you should try new things for your upcoming generation. बच्चे पुरानी चीज़ों से बोर होने लगे हैं. They don't want your slides, they don't want your PPTs, they don't want your 1 घंटे का lectures. And there was one teacher in my Bharati, I would like to take her name, respected Pravina Mahadalkar ma'am. She taught us nursing education subject in first year MSc. She was a teacher, उनके क्लास के लिए हम वेट करते थे. She used to tell us, teach students as like they are your friends. Don't become a fear person, otherwise बच्चों को डर लगे आपके क्लास में बैठने के लिए, ऐसा मत करो. Be a friends with the students, but with the disciplines. So as we discussed about the digitalization also, as Dr. Shivcharan sir said, कि digitalization as well as some electronics gadgets are available in the markets, as well as tools are available in the markets. Various technological modes are available at our markets. And you can see in other professions, they are very effective. So in our nursing also, we have to implement this. And the simulation practice, that is a one trending topic we have to implement as innovative teaching strategy in every colleges. As well as our panelists told to nursing teachers as well as the students, please try to attend conferences, workshop, try to involve in the social learning activities and various field visits as well as the industrial visits also. There is one question from the participation. Sir, how gamification can help the learning? Question came from Miss Annie Satya Christie, ma'am, from Harsh Institute of Nursing, Khamgaon. Miss Annie, ma'am, she's there? Okay. So I would like to tell कि this panel discussion is open for the discussion. If there is any question from the participant, you can ask to the panelist. Please. You can raise your hands. We'll give the mic. Organizers, please give the mic. If any questions from the participants, you can raise your hands. If you are facing any problems while adopting the innovative teaching strategies in your college, otherwise, if you want to ask anything, you can ask to your panelist. Yes. Organizers, please give mics to them. Yeah, please. I will give. Please tell your name and institute name also.
First of all, good afternoon to everyone present here on the dais and my dear teachers and colleagues. Myself, Arbaz Patan, I am a student of MSc Nursing. I belongs to Child Health Nursing and I belongs to MVP's Institute of Nursing Education, Nasik. Sir, when I passed my BSc, I was working as a teacher. But I do not have any of the experience. But when I was calculating or living in that surrounding, when I asked the students, what is your aim? The students only told me, my parents had taken my admission and I want to do it and make them happy. So, as a working for 1 year, I had taken an experience. But my aim is to that, I belong to a small family, but my aim is to that, in a future, in a nursing era, I want to change something on my basis as well as in collaboration with the MHS. And first of all, as a working as a teacher, first of all, the teacher should change the mindset of the student. They only say that I will be working in 20,000 payment, I will be doing marriage, and I will be settle my family. But what about your father? What about your mother? And what about your nursing profession? You are working as a nursing profession for not providing the care, but to have a innovative strategies and the technologies. Thanks to all the teachers and the students who have given me the best education till now. But as a student, I want to tell something that MHS is planning innovative technologies and the strategies for us. But how much, sir, it is getting implemented? There are various of the college. I want to not take the name of that college. There are 70% of the college. Sir, whether they are fulfilling the criteria of the staff, which is given by the MHS. Sir, I am not that much able to stand here. But my question is that only. First of all, MHS should take a strict action and have a teachers on that particular college. If the teachers are there, there only we will have a nursing profession to the sky. In case In case we are planning the innovative technologies, I have attended the conference, but I have treated well from receiving to the hostel, from hostel to the conference. Everything was good, sir. But my question is that from sitting this audience, how much have gained the questions and how much you understand from this? Can anyone tell me what happened in the last session or previous day? You have said that teachers are sending to the college from the college and they are only representing the college. But which college do you belong? You just do not represent it. You should make that college and make a good opportunity. And whatever you are having a problem, you should face in front of them. Because those who are on the dais, they are in with, I know them, but I do not have any contact. But I see them into MHS when I was a teacher, to the various inspections also. But my aim is only that, change the mindset of the student. There are not only the diploma, degree and the PG courses. There are other courses rather than it also. So there was a good intention that innovative teaching strategies were planned for that. And sir, my only one suggestion is that you should get in collaborate with MHS and first of all fulfill the criteria of the college. Then only simulation lab for the colleges and afford it. Thank you so much.
May I know your good name? Arbaz, Mr. Arbaz. Thank you, Mr. Arbaz. Actually, it's a topic of debate nowadays, but we don't want to go in that topic. But thank you so much for raising this concern regarding the shortage of the faculty and the regularity of faculty. We will
Actually,
hear from our respected panelist member.
I want to add, I
Yes.
want to tell him,
Yes.
I am seeing myself 10 years before. I was same like him only.
Yeah.
Same like him. International conference was going on. All the TNA executives were there. And I told them, Ki, you are just sitting on the dais. You are telling all the theoretical things and all this will do, this will do. Will you give chance to me to change the nursing? They have told, yes, definitely. Just after this session, we will meet outside. And you just write whatever the point is there and we will definitely do. This happens with me also. The thing is that as I started questioning one or two questions, my principal, my colleagues has stopped me. अरे बाबा conference चालू है बस नंतर बोलूँ अपन. Happens, my dear colleague. मैं colleague ही बोलूँगा because you are just with us. But the thing is that I learned in that 10 years one thing. Again, I am very practical person. That all the changes should be start from me, not expect from the others. Because once you are just going to, for your job, you are going for the interview, the package you will get, they will not get. जिनके बारे में हम बात कर रहे हैं. The thing is that the system we cannot change. And our own system. मेरा भी ऐसा था, जस्ट जो मैं 10 years बिफोर बोल रहा हूँ, कॉन्फ्रेंस में सेम बोला, यहाँ पे बहुत सारी बातें होती हैं, इम्प्लीमेंट कुछ नहीं होता, बिकॉज जो हमारे सीनियर्स हैं वो हमें कभी मौका ही नहीं देते. एंड आई हैव टोल्ड वन थिंग ऑल्सो, उनकी एज हो गई है, उनको जस्ट टाइम निकालना है बस. दैट इज़ अ फैक्ट. मैंने ऐसा भी फील किया था कि उनका एज हो गया, दे विल बी गेट रिटायरमेंट, वाई दे हैव टू जस्ट पुट देयर हेड. इतना क्यों वो मेहनत करेंगे और हमें तो चांस नहीं देते, बिकॉज हमें चांस दिया तो उनका पोजीशंस खतरे में आ जाएगा. बट द थिंग इज दैट आई हैव चेंज माई सेल्फ. आई एम एट गुड पोजीशन, एट गुड लाइक मैनेजमेंट. whatever I couldn't do in that era, that time, 4-5 years, I am able to do now. अभी मैं वो सब कुछ करना चाह रहा हूँ और कर रहा हूँ एवरी स्टेप्स. जो चीज़ें मुझे उस टाइम पे ऐसा फील होती थी ये होना चाहिए, अभी मुझे मिल रही है मेरे मैनेजमेंट से, बिकॉज तब से अभी तक मैं हारा नहीं हूँ. आई एम जस्ट बिहाइंड दैट. फॉर एग्जाम्पल, जस्ट मैंने जो बोला, आई वॉज नॉट सेलेक्टेड इन द NSS in 2002, बट आई वॉज सेलेक्टेड इन द NSS in 2013 एज ए कंटीजेंट लीडर. मैं एज ए स्टूडेंट परेड करने नहीं गया, लेकिन मैं मेरे महाराष्ट्र एंड गोवा का, अलॉन्ग विद आई वॉज द कंटीजेंट लीडर ऑफ द ऑल ओवर इंडिया. इंडिया का नेतृत्व करने के लिए 26 जनवरी की परेड में मैं था, बिकॉज वो जिद छोड़ी नहीं. तो मैंने अपने आप को चेंज कर लिया कि ठीक है, इन्होंने मुझे चांस नहीं दिया ना, अब मैं लीडर बन के जाऊंगा, एज ए स्टूडेंट नहीं. तो अब अरफाज ना क्या नाम है
Mr. Arbaz.
Arfaz, I am very happy that you are at least raising this concern, but my suggestion is that you start from yourself. Don't like the
Yes, we will give the chance. This is your
yes,
platform.
definitely.
I know the topic and panel discussion is going on innovative teaching strategies and what are the changes we should adopt it. Definitely, there will be a adequate staff requirement, facility requirement to adopt and implement the innovative teaching strategy. I respect your concern about profession as well as future of nursing, and really thank you for raising this concern. And thanks to my respected panelists also. This is an issue and that will go on, but change should come from us. अगर हम गलत नहीं करेंगे तो people will not dare to tell you कि this thing we have to do. So we will change automatically. Someday in future profession will change and we will able to apply innovative teaching strategies for nurses as well as students. Okay, thank you sir. आप कुछ बोल रहे थे sir?
हाँ सर.
Yes please sir. Yes Mr. Arbaz, you can come forward please.
One discussion was there कि what strategies we are using for UG students and PG students.
Yes sir.
The background of UG students is almost similar. They are 12th pass and just came to learn UG standards. So a similar strategy cannot be PG students. PG student, one of the PG student can be can have worked almost 2-3 years in ophthalmic OT. Other students might have worked in the CVTS OT. The experience of the UG students who has worked in that particular area has to be considered while teaching to the PG students, so that other students will be motivated and other students will get the advantage of that teaching. If this strategy is used, then the other students will be benefited from that. Second thing, I was a teacher since from last 20 years and I was getting this difficulties that some of the students are very best learners. They know everything by teaching them very few things, and some of the students are while we talk to them 10 times things, they will not understand that particular things, and both students are in the same class. So bridging the gap between those students are difficulties that a teacher should see, and what teacher should do to bridge that gap, that should be taught.
Thank you sir. Yes. Yes Mr. Arbaz. Please.
Sorry, I am having certain my questions. Yeah. Yes, sir. You said you can change, sir. Only one person I am that. So everyone should take a hand together so we can do that and achieve that platform. Myself cannot change. I can achieve for myself only. If I do the various diploma courses, went to the another profession or something to be changed. But if the teachers, the students, they will learn in a particular, not in a four wall. They should go outside of the door. As you said, many of the things, visits, we are lacking in the visits. We are lacking in the syllabus. When I was working, I had seen that also, that syllabus is not getting completed, but we are getting signed from the students. So we are planning innovative strategies for everyone, sir. But it's a humble request that it should be get implemented. Various colleges are implementing, but what about the left one? If we implement today, and the inspection will be done, after that 2-3 years, the skill lab will be there. What about the past batch of that 2 years? So my intention is that only, I will change myself, because I was also mindset that my parents had told me to go to the college, I want to do it, and I had done the BSc. But after doing my 1.5 year experience, I have a certain problems, certain assessment I have done. But in that I have only seen that there should be a change in the nursing era. Because when we go to the hospital, I do that also for the 1 month. Sara belongs to PD Hinduja. I was working there also for 1 month. But there was no respect. There was a humble request to that there that doctors say that you should do this only, but I am as a nurse, I cannot do that. My work is my profession, so I will do only that. What the nursing is that? To provide the care, to give the support, to give the everything to the patient, but I cannot treat him. But my concern is that only that the innovative strategies you are planning, it should be get implemented within 6 months or the 1 year, not after 2 years, 3 years when the inspection is getting to get. Tomorrow is the inspection, the skill lab will be today at that college. Am I right, sir? So, sir, these changes should be done. You are planning good for us, but that is not implemented on us. So that should be get implemented against your strict supervision. Thank you.
Thank you, Mr. Arbaz. Those people are watching at online, all HOIs, all administrators are seeing our panel discussion. And Mr. Arbaz, really, if thinking will be in a positive manner, we will change the future of nursing in future also. So thank you so much for this fruitful discussion. And with this, I would like to conclude this panel discussion at come to end. I really thankful to all my respected panelist members for accepting our invitation, sparing your valuable time and knowledge with us, and for our participants also. I would like to thanks to whole management of Godavari Foundation, organizing team, and all the participants for patiently listening and having a discussion. Thank you so much. Thank you so much, all of you.
On behalf of all panelists, I would like to thank Godavari Foundations, Godavari College of Nursing Principal, Professor Vishaka Madam, and all the organizing committee members for inviting us and giving us opportunity to share our ideas in front of you all. Once again, I thank all the organizers. Thank you very much.
So by this, our panel discussion is over. But I would like to thank all our panelists coming from various excellence backgrounds, giving us various innovative teaching strategies in the field of nursing education like gamification, simulation, TOTs, storytelling, and also about faculty development programs to motivate this young generation students and deal with them. I also take this opportunity to thank our moderator of the session, Mr. Swapnil Rahane sir, for smoothly carrying out the session, leading this discussion in such a way that we, the participants, could gain knowledge about all these updated teaching strategies and could implement this in future. Thank you so much, sir. Further acknowledging their contributions of the panelists and moderator, we, the Godavari College of Nursing, would like to hand over a memento and certificate. Firstly, I would like to invite Dr. Miss Manorama Kashyap Madam, HOD of Medical Surgical Nursing Department, to hand over the certificate and memento to Dr. Milind Kale sir, Principal, MES College of Nursing, Ghanekund, Lote. Thank you, ma'am. I request Professor Ashwini Vaidya ma'am, HOD of Mental Health Nursing, to hand over the certificate and memento to Dr. Vishwanath S. Biradar sir, member of BOS, Vice Principal of MGM Mother Teresa College of Nursing. Dr. Priyadarshini Moon Ma'am, HOD of Research Department, to hand over the memento and certificate to Dr. Shivcharan Singh Gandhar, Principal of Vishwaraj Institute of Nursing, Pune. I request Professor Nirbhay Sir, Community Health Nursing Department, to hand over the certificate and memento to our moderator of the session, Professor Swapnil Rahane Sir, Assistant Professor from Parul Nursing College, Vadodara. Once again, a big thanks to the moderator and the panelists of the session. Here we come to an end of the morning sessions and will break for lunch. I request the volunteers to escort the dignitaries for the lunch. Delegates, kindly be seated till the dignitaries move out of the hall. Please maintain silence.